Pharmacists in Ontario will soon be able to assess and prescribe medication for certain ailments. The province is expanding the scope of practice for pharmacists starting in January of next year. The hope is to help take strain off other parts of the healthcare system. But the Ontario Pharmacists Association wants the province to go even further. Justin Bates is the association's CEO and joins us. Good afternoon.
Good afternoon, and thanks for having me on your program.
Thanks for having me on. Let's talk about the current role of pharmacists. Can you sort of just briefly outline what that is?
Well, pharmacists have 6 years of university education and something called a Doctor of Pharmacy. And currently, they provide a number of community-based health services around medication management. So there is what most people would recognize and appreciate around the dispensing of medications. But over the last decade and a half, pharmacists have expanded their scope of practice, leveraging their knowledge of medications and of health conditions to start providing additional counseling services. And they're really a healthcare community hub now. We see them providing testing related to COVID and other chronic conditions. We now see them involved in vaccinations. They've been providing flu shots, as an example, since 2013. And we're building off of that expertise to try to create more capacity in the healthcare system and increase access for community-based healthcare services.
Can pharmacists actually prescribe any medications right now?
There's one in Ontario. It's a smoking cessation product and counseling that's associated with it, but that's essentially it. Ontario is far behind the other provinces and in fact other global jurisdictions when it comes to scope of practice. So we're playing a bit of catch up. An example would be even for antivirals that are very critical right now when it comes to COVID with Paxlovid. There are several provinces that move to implement prescribing authority and the testing and dispensing so that you had a turnkey solution in one location, which would expedite time to treatment, which is so critical given the onset of symptoms to treatment is about 3 days. So that is just one example, but pharmacists in Alberta can prescribe just about any medication other than a controlled substance. So when you look at welcome news, and we've made a lot of progress in Ontario and working with the government to enable minor ailments. It is just the start, and there's much more to do.
So then starting in January, what ailments will you be able to prescribe for?
Yeah, so what's going to happen is the pharmacist is going to walk through a standardized process in assessing the patient first, because not in all cases, when the patient presents themselves, will it result in a prescription. It could be a referral to see their family doctor or go into emergency if there are other complicating factors. It could be go home. This is not needing any medications. It could be recommendation for an over-the-counter remedy, or it could be a prescription. And there are 13 that have been enabled. They range from things like urinary tract infections, which we know, if not treated early, can certainly increase in complications and have patients end up in emergency departments or trying to get a primary care appointment. Atopic dermatitis, insect and tick bites, which is particularly prevalent in the summer, and we're seeing an increase in tick bites. Pink eye, allergic reactions like rhinitis, which are similar in terms of presenting like a cold, but not infectious in the same way. Cold sores, hemorrhoids, gastro reflux disease, so that's GERD. Things like sprains and strains, and impetigo, which is like skin lesions. So a number of skin-related conditions that are minor in nature but could get more complex. And while they're minor, it still keeps people out of doctors' offices and hospitals, because those places aren't going to go underserved. And we know that there will be people presenting themselves in the hospitals and in doctors' offices, but you want the right person at the right time, at the right location, so that we use our precious healthcare resources effectively.
It almost sounds, the way you're describing it, as if you have now taken the role of the initial gatekeeper, and that rather than people who have not serious ailments, but perhaps more minor ones, rather than them trotting off to see their doctor, they're coming to you and you're making that initial assessment. Is that right?
Well, I don't think it's replacing or in any way taking away from other healthcare providers. Our view is that all healthcare providers, be it physicians, nurses, PSWs, you can go down the list, should all be practicing to the maximum of their scope, their education, and their expertise. We need that as a team approach in
Right,
Ontario
right. But
to
let's just say,
combat our
yeah.
burden.
No, but I'm just wondering, like, let's just say they can't get in to see their family doctor, right? As like, there aren't enough family doctors, as we know, generally speaking. Many people don't even have a family doc. Could you not take on that initial role then for, again, not serious ailments, but perhaps more milder ones?
Well, absolutely. This is the plan to create that capacity and reduce the burden on the system by leveraging what we have in the community with over 5,000 community pharmacies as healthcare hubs. People have shown through a number of public opinion polls high trust with the pharmacist and the relationship they have. And the pharmacist has this expertise in education. So it's not something that's net new for them. It's just enabling them to do it. And our hope would be that we can reduce up to a third of the emergency department visits based on a U of T study that are minor in nature, but because of the lack of primary care physicians and other challenges in access, particularly in rural communities, it burdens the healthcare system.
And then what about privacy? How do you maintain privacy in these kinds of situations with patients coming into the pharmacy and being assessed?
Well, that's a great question. And you've probably noticed an evolution in the format of pharmacies. And there are very different models. There are larger box stores, there are small independents. So each one is going to implement this slightly differently, but they all are creating either semi or full private spaces where it's more of an appointment based model. So it's that interaction between pharmacist and patient in a confidential, private nature so that we can provide these types of healthcare services.
And who pays for this service?
Well, at the moment, that's what we continue to work collaboratively with the Ministry of Health. We're in discussions for achieving public funding, similar to other healthcare services that are provided through the OHIP program. Right now, though, there is no commitment yet to fund this. And our concern is that we don't want this to turn into a privately funded model or out-of-pocket expenses because we won't be able to achieve equitable access for all Ontarians if we don't make sure that public funding is made available.
Now, it's interesting because I understand you don't think this goes far enough. I have to say, whenever I go into my pharmacy, the pharmacists are super busy. Why do you think this doesn't go far enough?
Well, I'm looking at two things. One, I think it's a significant milestone, and it's welcome that we're introducing this in January. The government really looks at it as two windows to implement new regulations. There's July 1st and January 1st, and we missed that window for a variety of reasons of July. So 5 months is not a long time, but certainly implementing it sooner would help ease the burden in the healthcare system. And it is a cautious approach. So while
Yeah.
it's welcome and we've made progress, only 13 conditions. If you look at Alberta, you look at Saskatchewan, New Brunswick, they have a significant number of additional conditions. So, we'll get there. I think we'll demonstrate the outcomes and the value of this program, and we'll add, hopefully, conditions as time comes. But given the crisis we have in the public healthcare system today, I think there's an urgency behind trying to move
All
forward.
right, we'll leave it at that. Thanks so much for joining us, Justin.
My pleasure. Thank you.
Thank you. That's Justin Bates. He's the CEO of the Ontario Pharmacists Association.